Yo, it's about to go down. I said, yo, it's about to go down.
What's going on? What's going on, Warriors? Happy Saturday. Welcome to a special kidney disease education moment. I am your host, Steve Belcher. Thank you for joining me. So I don't have anyone in the broadcast right now, but that's okay. We're going to continue with this broadcast as planned. This broadcast, beta blockers and the importance of medications. Very important topic. A lot of kidney patients are taking beta blockers and don't know why they're taking them. They just know they're taking a beta blocker. So today, I want to do a 30-minute education piece on beta blockers and the importance of taking your medication if you're a kidney warrior, right here on Urban Health Outreach Media. So let's get started. Beta blockers, you may have heard that term, are a type of medication used to treat heart failure or sometimes high blood pressure. So let's take a look at what this means and what beta blockers can do to keep you healthier. Please, for the two people or the one person, share this broadcast. I will never understand for the life of me. You have a free broadcast with pertinent information, more than 700,000 people dealing with chronic kidney failure, but yet we only have one person on the broadcast. God bless you. Hope you get something out of this broadcast and hope people will come back to look at this broadcast to understand what beta blockers are and the importance of medication. So let's take a look at what this means and what beta blockers, again, can do to keep you healthier. What is heart failure? Heart failure is when the heart is not able to pump out as much blood as the body needs, right? This is a problem because your body won't get all the oxygen and nutrients it needs from the blood. Heart failure can happen in a couple of different ways. In some people, the heart has trouble squeezing blood out, right? In other people, the heart has trouble relaxing. And, the heart has trouble relaxing. Your heart needs to relax in between heartbeats so that it can be filled with blood. If your heart doesn't relax enough, it won't fill up with as much blood. If it doesn't fill up with as much blood, then it can't pump as much blood out to your body. So you got your brain saying, I need more blood. Your heart saying, I'm trying. And then your body, your kidney saying, we need more blood. Now, how does your body respond to this? How does it? When your heart is not pumping out enough blood, your body sends out a message. A messenger is a hormone signaling that tells your heart to beat faster to make up for this. Unfortunately, this makes your heart work much harder, a lot harder. And that's why we say when a lot of warriors, when they go to kidney dialysis and they have heart failure, when you're trying to put off a lot of fluid, that can be stressful to your heart. So this can actually cause more damage to your heart by it pumping harder, right? So how do beta blockers treat heart failure? How do beta blockers treat heart failure? Now, this is where the beta blocker comes to the rescue. Beta blockers get their name because they block the messenger hormone, right? They block that messenger from telling your heart to beat more faster. Since your heart is now beating slower, it has more time to fill with blood. Therefore, more blood can be pumped out to your body. Beta blockers can also help your heart squeeze out blood better. So, if you take a beta blocker, it's very important to take these medications exactly when you are prescribed to do so. Beta blockers can also treat other high blood pressure. When your blood pressure is too high, your blood pushes against the walls of your blood vessels too hard. It's just pumping, it's pumping, it's pumping. Over time, this can damage your blood vessels. This can limit the amount of blood that can flow through them to your body. Now, it can also damage your heart and kidneys. That is very important with the blood pressure. Can damage your heart and your kidneys. Some beta blockers can help relax your blood vessels so that there is more room for blood to flow through. Right? This makes it so that your heart doesn't have to work harder. So again, guys, beta blockers can be used to treat heart failure and can also be used to treat other blood pressures. Which one of your medications are beta blockers? Depending on what condition you have, your doctor may prescribe multiple medications that treat heart failure or high blood pressure. Here is a small common list of medications that are considered beta blockers. Atenolol or tenormin, bisoprolol or Zabeta, carvedilol or Coreg, labetalol or Transdate, or metoprolol or Lopressa or Toprolol. Also, remember, it can be dangerous to suddenly stop taking a beta blocker. Talk to your doctor if you have any questions or concerns about any medication. Excuse me. All right, let's move on to the importance of medication. As we're only 10 minutes into this. I got one person, so this won't be fast. Won't be able, do the whole 30 minutes. So again, thank this one person who's watching. God bless you. The importance of medication. Medications are mighty. Working kidneys do so many important jobs for your body. When they stop, right? When they stop working well, you need multiple medical treatments to take over all these jobs that the kidney is now not doing. The first treatment you need is dialysis. It replaces some of the key jobs your kidneys perform. Dialysis can't do all that your body needs alone. It needs a mighty, mighty partner to keep your body going. That partner And you guessed it, medications. They are a dynamic duo of epic proportion. While everyone has unique needs, right? We're going to learn about the most common medications for people on dialysis. So here are 7 common drugs prescribed for kidney warriors. You got your EPO or your erythropoietin. You got your iron. You got your vitamin D. You got your phosphorus binder. You got your B complex vitamins. You got your topical creams or your antihistamines. Also with the B-plex vitamins, you have your folic acid, and then you have your vitamin E, which preventive measures for cramps. A lot of patients don't know that. Now, let me just so I'm going to go over what these medicines do, but before I do that, let me move on about these medications. Some medications are mighty defenders against the harmful toxins your body can no longer remove. Some control your blood pressure so your heart doesn't work so hard. Some medications help your body make red blood cells, like the EPO. They carry oxygen you breathe to the places in your body that need it. With all these jobs and more, it's easy to see why medications are really important. Please take them as your doctor has prescribed. If any of your doctors change your medications, please let your nephrologist know right away. Next time you see your pill bottle, remember, these are no ordinary medicines, right? They may not have the mass, but they are still personal defenders. When I come right back, we're going to talk about the 7 drugs that's common, that's prescribed for kidney warriors. I'm going to go over with you right quick after this video.
Yo, it's about to go down. I said, yo, it's about to go down.
All right, guys, what's up? This is your boy Steve Belcher, Urban Health Outreach Media. I'm going to go over the 7 common drugs prescribed for dialysis patients. So, as I mentioned, we got EPO or erythropoietin. All right. Nearly all patients with end-stage renal disease who are on dialysis have anemia. Anemia occurs when a person has a low red blood cell count. Kidneys make and secrete the hormone erythropoietin. Erythropoietin is the hormone responsible for keeping a normal red blood cell count, and the kidneys are responsible for making and secreting this hormone. Most patients with renal failure on hemodialysis will get erythropoietin or EPO during each treatment by intravenous injection into the return dialysis tubing. Most peritoneal dialysis patients will get erythropoietin by injections directly under the skin. Normally, red blood cells make up about 36 to 44% of the blood. Before erythropoietin was available, most dialysis patients had a red blood cell count of only 20 to 26%. Now, with proper management, people with CKD on dialysis have normal red blood cell count. And a lot of patients in the past, before EPO, used to get blood transfusions in the unit. Hey, Angie, thanks for tuning in. God bless you. Thanks for tuning in. God bless you. Hi, see you on YouTube. Thank you for coming in on that YouTube channel. Please share our broadcast, and if you can get people to come and subscribe to our YouTube channel, that would be Awesome. Again, thank you for tuning in. Guys, let's make this go viral. We talk about, again, not making anything go viral. Kidney disease is not viral. They're not talking about it mainstream. Here I am, Saturday evening, talking about beta blockers and the importance of medication regimen, which a lot of warriors don't even know about or think about. And I'm trying to get that message out. So I need your help. Share this broadcast, share it afterwards. Let's make this go viral, guys. I can't do it alone. Number 2, iron. That's another common medication patients on dialysis get. In order for the EPO or the erythropoietin to work well, iron needs to be present to make red blood cells. All right. It needs to be present. Excuse me. Granddaughter texting me. So anyway, iron needs to be present to make red blood cells. Without iron, fewer red blood cells are made and are smaller in size and not able to carry as much oxygen. Small amounts of red blood cells with iron are lost during a hemodialysis session. They are. And a lot of warriors don't think about that. If iron is not replaced, eventually dialysis patients lack enough iron and erythropoietin and do not function as well. Because of this, most dialysis patients need to receive iron. Many dialysis units now give small amounts of intravenous iron during hemodialysis. That stuff tastes like licorice. That's what I've heard. Regular blood tests will tell a patient's doctor if they need iron therapy. With careful iron management and the use of erythropoietin, over 90% of patients can enjoy energy levels that come from having a normal red blood cell count. Active vitamin D, very important. All right, very important. Active vitamin D. People with chronic kidney disease and those on dialysis can experience loss of bone minerals, including calcium and phosphorus. A lot of people didn't know that you can lose bone minerals. The calcium and phosphorus can also mix together, get hard, and build up, forming calcifications. How many patients heard of calciphylaxis? We all seen it. Calciphylaxis. You may have seen some patients with it and had to get amputations. You've seen some patients in the hospital for long periods of time because of calciphylaxis. Calciphylaxis. And here it goes. It says it again. The calcium and phosphorus can also mix together, get hard, and build up, forming calcifications in the small blood vessels of the feet, intestines, and heart. This condition can lead to amputations, abdominal pain, gangrene of the intestines, and heart failure. This is calciphylaxis that they're talking about. These complications are due to the mix of dietary calcium, phosphorus, vitamin D, and a hormone called PTH or parathyroid hormone. Active vitamin D controls the balance of calcium, phosphorus, and PTH. But, and that's a but, vitamin D that the body naturally gets from sunlight and food is inactive when renal failure occurs. The oral form of active vitamin D may be effective in preventing high PTH. So when your kidneys fail, vitamin D that your body normally gets from sunlight, the naturally, and food is inactive when renal failure occurs. Phosphorus binders. When PTH level rise, there is inflammation in the bones. Plus, calcium and phosphorus are lost from the bones and move into the bloodstream. Because of kidney failure, the kidneys can no longer get rid of the extra phosphorus that's in the blood. Very important, guys. Dialysis removes only a little bit, just a little bit of phosphorus. Preventing or reversing this process can be done through diet and medicines such as phosphorus binders. That's why we stress the importance of taking your phosphorus binders with meals. Even when patients limit foods that are high in phosphorus, they would still have a high phosphorus level if they didn't take their phosphorus binder. The binders prevent the body from absorbing the phosphorus from the foods eating, because most patients will require 3 to 6 pills, capsules with every meal. Calcium absorption from some medicines can be significant enough to cause concern. Again, because most patients will require 3 to 6 pills or capsules with every meal, calcium absorption from some medicines can be significant enough to cause concern. It's always recommended to follow a doctor's prescription and ask questions if a person is concerned about his or her medicine. Number 5, B-Plex, vitamin, and folic acid. The dialysis procedure removes a large amounts. Let me repeat that. The dialysis procedure removes large amounts of water-soluble vitamins, such as vitamin C, B complex, and folic acid. Now, when I say B complex, I'm referring to the B complex vitamins. While a kidney diet can usually keep up with these losses, many people on dialysis don't always have an appetite. How many people don't have an appetite on dialysis? Most nephrologists feel that the use of a B complex vitamin along with a folic acid is a good protection for when patients don't have an appetite. Because heart disease is common in people on dialysis. Sorry, let me repeat this. Because heart disease is common in people on dialysis, many studies are now looking at medicines that can decrease the high rates of heart disease. High homocysteine levels are commonly found in patients. High homocysteine levels are commonly found in patients with heart disease and are also found in patients on dialysis. High doses of folic acid can lower homocysteine levels, and high dose folic acid therapy is being evaluated as a possible preventive treatment in dialysis patients. Number 6, topical creams and antihistamines. Many dialysis patients have itching and dry skin. Let me get a thumbs up if you're dealing with itching and a dry skin. While it is important to find and correct the cause, the itching can frequently be treated with topical hydrating agents or topical cortisone along with oral antihistamines. Last but not least, number 7, vitamin E. Some people who are on dialysis are prone to leg cramps while on dialysis and at nighttime. This can be due to the rapid fluid and electrolyte shifts in and out of muscle cells from the hemodialysis treatment. Vitamin E, again, vitamin E has been said to help many people as a preventive measure for cramps when taken either before or at home. I repeat, vitamin E has been said to help many people as a preventive measure for cramps when taken either before dialysis or at bedtime. People with CKD, as well as those on dialysis, need to be involved in all areas of their care. They must be an active member of their healthcare team by watching their diet and making sure they understand and take the medicines they need to improve their longevity and quality of life. Guys, thank you so much. I wish this could have been a bigger audience, but God says whoever's in this room are supposed to be here to get this information, right? And so when the other people need to get it, they will get it because this is able to be replayed. Please, guys, share this broadcast. If you haven't already subscribe to our YouTube channel, Urban Health Outreach Media. We need your support. We got hundreds of videos. I mean, hundreds of kidney disease education broadcasts, interviews, all kind of stuff. So education moments like this. So please, if you haven't already subscribed, please go to our YouTube channel, Urban Health Outreach Media, and subscribe. Let's make this broadcast go viral. Again, guys, thank you so much for tuning in. I know you could have been doing anything else other than here. So I humbly thank you. And again, stay tuned for more broadcasts during this time of crisis. And we ask you to tune in tomorrow at 8 for the Lisa Baxter Show. And then at 9 p.m., World Kidney News, we'll be talking with District 7 candidate, Baltimore City candidate for District 7 Council seat, Tory Rose. That's tomorrow on World Kidney News. Thank you, guys. God bless you. Stay safe. And again, don't panic. Be prepared. God bless you.
Yo, it's about to go down. I said, yo, it's about to go down.